Okay, this is comprehensive normal adult physical assessment. First thing we want to do is whenever we walk up to the patient, we want to look and see how does the patient appear. Are they speaking to us whenever they approach? Are they speaking to other people? What are their facial expressions like? Are they grimacing in pain? Or do they appear without distress? What's their general skin color? Are they pale, cyanotic? Do they look pink and warm? Are they making eye contact with us as we walk up? Or are they trying to avoid our eyes? Or are they unable to even notice us whenever we walk up? What is the patient's estimated weight? Is the patient grossly obese? Are they very thin and emaciated? Or do they look to appear in general good health? Does it look like they're having trouble breathing? Are they in tripod positioning? Anything just very obvious that you can notice? And again, also posturing. Is there any disarabid or decorticate posturing, or are they having trouble moving at all? Do you notice any odors, any fruity-like smells, any smells of alcohol, anything like that? Are they generally good hygiene and grooming, or are they disheveled? Is a good level of consciousness? Is the patient able to talk to you, or are they unresponsive? Are we able to get something with a verbal stimuli? Hey, can you hear me? Or are we getting anything with a sternal rub, and maybe it's just a painful stimuli that they're responding to or withdrawing from, something like that. So that's going to be kind of our general initial impression. Then we want to look more at their speech. Are they able to speak in full sentences? Are they speaking in 2 to 3 word sentences? Do they look like they're having good volume? Are they speaking very quietly, or is it very hoarse sounding? Are they having trouble getting their words out, or are they having trouble with a language barrier or anything like that? We want to look at that. Are they in a good mood? Do they look like they could become unsteady with us, or maybe combative at any point? And how oriented are they? Do they know what time it is? Do they know where they're at? Do they know who the president is? Do they know who they are, and also who we are? And then you also want to look at their memory. Do they have any amnesia with this event, or maybe in general, maybe they have some dementia or Alzheimer's, something like that. We also want to be looking at those signs as well. Then we want to get our baseline set of vital signs, getting an accurate blood pressure, checking to see if they do have a radial pulses present, if they're responsive, and then if they're not responsive, then we want to be checking for a carotid pulse to see if that is present. And we're checking the rate as well as how strong it is. And we just kind of want to make note of that. Then we want to check their respiratory rate and tidal volume. Are they taking nice full deep breaths, or are they very shallow, maybe very rapid? We want to make note of that. Then we can also check their temperature either with the back of our hand, or if we have some sort of device, we want to check their temperature. We can either do it orally, tympanically, or if necessary, rectally as well. And then part of that baseline set of vitals is getting good SpO2 reading and making sure our fingers aren't cold or purple or anything like that, and we are getting an accurate SpO2 reading. Then kind of a more detailed thing, going into our more detailed physical exam, we want to check that skin. What's our color of our skin? Is it flushed? We want to be exposing the patient at this point. Do we have jaundice anywhere, or is it pale, cyanotic, anything like that? Is the patient really sweaty, or do they appear very dry? Or is there any other signs of moisture? Maybe they just came out of a swimming pool or something. Is the patient hot, or are they cold, or do they feel fairly normal? And then we can also be checking the skin turgor here, and tinting of the skin on the back of the hands is a good spot to assess their hydration status. We'll be checking and looking around for any lesions and see if there is anything. And we just want to make note of those and make sure if we need to bandage those that is noted, and we can do that. Go ahead and look at their nails and nail beds. Is there any cyanosis below the nails? Do we have any clubbing of the fingernails or anything like that? Are they very dirty? Does it appear like the patient is able to take care of themselves and has been clipping their nails, stuff like that? We can look at all those conditions. Then starting from the head, we'll want to check the head, and checking the hair and the scalp, just kind of looking to see if they are in good health, if it's been cleaned lately, making sure there's no bugs or anything like that. Also, of course, checking for any trauma, decap BTLS, making sure there's nothing like that going on. We want to check the face as well for the same thing. Make sure that the patient is able to look at us, see if they have any blurred vision, hold up some fingers, checking all that. We want to be looking at their pupils to see if they are reactive. We can go and check those with the flashlight to see that they are equal, round, and reactive with light. And then that the patient is able to follow your fingers as well, back and forth, and then up and down. And that the patient doesn't appear to be having any double vision, blurred vision, or anything along those lines. We want to look at the ears, check the earlobes, see if we see anything. Go ahead and look in the ears. Do we have any drainage in there, any CSF that might be coming out, or anything else? And is the patient able to hear with us? And then if they are having trouble hearing, whether that's a new thing or whether that's a chronic issue that we don't need to be so concerned about. We want to, of course, look at the nose here, make sure there's no deformity of the nose, and then see if we can see any obstructions, any blood in there, or anything along those lines. And then have the patient go ahead and stick out their tongue if possible, and we'll also be noting, their speech and how well they're able to open their jaw. Any mucosal color, is there any cyanosis in there? Does the tongue appear very dry and cracking? Is there any signs of an infection there on the tongue or anything like that? Is there any obstructions, of course, back there? Any broken teeth or anything if we are dealing with a trauma? We want to look at the neck to make sure the trachea is midline. We don't have any jugular veins that appear to be distended or anything. Once we've checked that, we'll move down to the chest area. We'll be checking the chest wall, make sure we do have equal expansion. There doesn't appear to be any rib fractures or any open chest wounds or any closed chest wounds. Of course, we'll be checking lung sounds at this point and auscultating all 4 regions to make sure we do have good lung sounds. And if we do need to bandage open wound or something like that, we can go ahead and do that at that point. And if the patient has any pain with auscultation, we'll want to note that as well. We'll go ahead and check all of our heart. We'll go ahead and listen to it in all 4 spots, checking all of our valves, the atrial valve, pulmonic valve, and then tricuspid and mitral valves there. And just noting if we do have any abnormal sounds other than S1 and S2 heart tones. Then we also want to check the abdomen. First, of course, checking to see if there's any open wounds, and then we want to be checking also if we have any bruising. Is there colon signs, Gray-Turner sign, anything like that that could indicate that we have fluid in the abdomen. We want to be palpating. If there's no abdominal complaint, we can just go ahead and palpate it, feel if it's rigid or firm, or if it's nice and soft and non-tender, and we'll just want to make note of that. And of course, if they are having a abdominal complaint, we'll want to start at the region farthest away from that and then palpate over the region with the pain last. And then before we palpate, we do want to auscultate for epigastric sounds, and you want to make sure you do that before you palpate, because the palpation may cause a lot of abdominal sounds that will still be there whenever you go to auscultate. And then, of course, we want to check the back if possible. Go ahead and have them set up or roll them over, anything like that, looking for any bruising or any open wounds. And again, DCAT, BTLS, making sure you feel the spine if there's any signs of step off or anything wrong with the spinal cord, if they're having any tenderness, anything along those lines. And you see any scars that would go along with that. We want to palpate the pelvis, checking it down and in, make sure we are stable with that. Then with the male genitalia, you can look for any rashes or wounds, and if there's any discharge, whether it be urinary or otherwise. And then you could also, if it is trauma, you can check for priapism and do that at that time as well. For the female genitalia, you'll again check for the wounds and rashes and see if there's any drainage, and then ask the patient about any bleeding or discharge they might have had recently. Moving down the legs and feet, you just want to make sure that they are symmetric, make sure that they're about the same length, and that we don't have any shortening or rotation with those. Make sure we do have good PMS intact in both distal extremities. Have them wiggle their toes, everything along those lines. And that the pulses are present. You can check for femoral pulses, popliteal pulses, and then dorsalis pedis pulses. With the arms, then you'll check again, make sure that they are pretty symmetric. They do have good range of motion, you know, they're able to move them around. There's good color with those, and they're nice and pink and warm. Y'all, of course, checking everything for decap, BTLS, making sure there's no obvious injuries with those. And then you can also check brachial pulse or radial pulse if that is present.